Well, hospitals have come under massive pressure as a direct result of this pandemic, but facilities that help mental health patients are also reporting high admissions. The South African Human Rights Commission visited the Northwest Province this week to monitor patient rights. eNCA's Tshegohaco Moagi has that story.
A psychiatrist in the Northwest says more patients are being admitted. This comes as more people are seeking help for a mental condition, mostly due to the COVID-19 pandemic.
Initial lockdown, it was quiet. I think people were scared to come out of their houses, but after that it started picking up, and now it seems there's a very much of an increase in patients.
And what are people seeking help for?
A lot of depression, anxiety, some even post-traumatic stress. There are some patients who've had COVID that get admitted after that because of the stress that they had to go through. And also all the people that are losing people. There's a lot of grief and loss that people struggle to cope with.
Meanwhile, the Human Rights Commission in the Northwest visited some mental health institutions.
We've seen that the Department of Health in the province has invested in the infrastructure. The Bopilong Psychiatric Hospital in Mahikeng, we are told that it's also being used as a benchmark for other provinces.
But what are some of the challenges faced by these facilities?
You have a beautiful hospital that is big and has the required resources to provide healthcare services to mental health care users. But you find that there's only one psychiatrist, there's shortage of occupational therapists, nurses.
One mental health patient says her stay at one of the institutions in the country was a breath of fresh air.
It didn't feel like you were in a hospital or even an institution, a psychiatric institution, not at all. It was just a therapeutic resort.
The Northwest Human Rights Commission says it will put together a report with recommendations to the Provincial Health Department. Tshegohaco Moagi in the Northwest.